A 2-month-old baby presents with cyanosis. I'm showing you the chest radiograph. Describe the findings.
Okay, assessing the provided imaging. The chest radiograph demonstrates a right-sided aortic arch. The overall heart size is normal, but the cardiac apex is elevated and rounded, producing a classic boot-shaped heart. This boot shape indicates right ventricular hypertrophy. Furthermore, the main pulmonary artery segment is concave, and there is a reduction in the caliber of the pulmonary vessels, indicating oligemic lungs. Overall, these features are highly suggestive of Tetralogy of Fallot, and the differential diagnosis includes other causes of cyanotic congenital heart disease with a right-sided aortic arch, such as truncus arteriosus.
What are the 4 classic anatomical components that define Tetralogy of Fallot?
Well, Tetralogy of Fallot is characterized by 4 key features resulting from the anterior superior deviation of the infundibular septum. These include obstruction of the right ventricular outflow tract, which can be infundibular or valvular stenosis. Second, there is a large non-restrictive ventricular septal defect. Third, right ventricular hypertrophy develops, which gives us the boot-shaped heart on the radiograph. And finally, there is an overriding aorta.
I am now showing you a chest radiograph of another neonate who also presented with cyanosis. What are the findings here, and what is the likely diagnosis?
Okay. As seen in this second chest radiograph, there is cardiomegaly with a narrow superior mediastinum. This creates a classic egg on a string, or egg on its side, appearance of the heart. In stark contrast to the first patient, the pulmonary vascularity here is significantly increased, indicating plethoric lungs rather than oligemic lungs. These findings in a cyanotic neonate are characteristic of transposition of the great vessels. Although this particular patient has a left-sided aortic arch, a right-sided aortic arch can also occasionally be seen with transposition.
What are the other primary causes of cyanotic congenital heart disease, and how can they be categorized radiologically based on pulmonary vascularity?
Cyanotic congenital heart diseases can be broadly categorized into those causing oligemic lungs and those causing plethoric lungs. Conditions with decreased pulmonary vascularity or oligemic lungs include tetralogy of Fallot, pulmonary atresia, and tricuspid atresia. Conversely, conditions that typically present with increased pulmonary vascularity include transposition of the great vessels, truncus arteriosus, and total anomalous pulmonary venous drainage.
How would you manage the patient with Tetralogy of Fallot as a radiologist?
As a radiologist, I would urgently communicate these findings to the referring pediatric team. I would recommend a formal diagnostic echocardiogram to evaluate the precise degree of right ventricular outflow tract obstruction and measure the ventricular septal defect. I would monitor the chest radiographs for any signs of developing heart failure or progressive hypoxia. Finally, I would ensure the patient is referred immediately to pediatric cardiology and cardiothoracic surgery for definitive surgical repair.